Okay, so I'm going to be going over inline suctioning, cuff pressure monitoring, aerosol, and MDI all in this video. So I have my tiny little bitty ET tube set up here, my inline suctioning. So the first thing that I'm going to do is check my cuff pressure. So we have these little disposable cuff pressures here. So I have my little pilot balloon is inflated, and I'm just going to connect this to the bottom here. So it is saying, here, let's pull this up a little bit. It is saying that I'm just a little bit above the green. So just so I'm in kind of that green area, I'm just going to inflate my cuff a little bit more. If I go too much, then it'll go all the way into the red, and we don't want our cuff overinflated. So I'm just going to keep it right here in this little green area. And you see once I pull it off, that springs back up. So here we're good. Still in the green. Perfect. So my cuff is all good to go. The next thing that I'm going to do is suction my patient. So I have my inline suctioning here. I will connect this to the suction and then the wall. Make sure that the wall suction is on. I have a good connection. Make sure, always test it before you go to suction the patient. Sometimes people will put it like this or even lock it so you can't suction. So just make sure that it's turned correctly and that it's on. I make sure, of course I have gloves on and wash my hands, but I make sure that I have a good connection, that I kind of am hanging on to the ET tube and the suction, so when I'm pushing anything in or pulling it out, I'm not disconnecting the ventilator or anything like that. You're going to want to mute the alarms on your ventilator while you're doing this, because it's going to alarm saying that you'll have an obstruction, which you do, it's your suctioning. So you're going to just push this down the ET tube. You can see that little black line going down. And then you're going to go until your patient kind of has a gag reflex and coughs. So you're going to tell your patient big cough, and then suction all the way on the way out. Gently pull the suction out and suction on the way out. And then repeat as necessary. The next thing would be my inline MDI. So here's my little adapter. Pretty simple little thing. This will go in line with your ventilator. So you just take your common canister, patient-specific canister, and then pull out the actual medication. And this white part goes in this little hole right here. You just kind of twist it on, push it on, and then you just push down, and it would administer the medication. 1 puffs, 2 puffs, however many you need, according to the dosage. And then just put it back so you make sure that you're counting. And then the next thing is my inline aerosol. So I have this little piece of equipment. This is my Aerogen. I have it plugged in. And I've got my 2 adapter pieces. And this little cup is where you put your medication in. Just in right here. I just have some saline in there right now. And this kind of little gray piece just plugs in right there. There's only 1 button to hit on this. So you hit that, and as you'll see, it'll start administering the medication. You just want to make sure that you don't leave the room until your Aerogen cup is empty. This assures that you've given the patient all of their medication. And these can be kind of picky. Sometimes they'll stop kind of working, so you just want to make sure that you're watching it to make sure that your patient is getting the full dose of their medication. And that's it.